Hi, everyone. Hello. Come on in and join us. I'm here with my special guest today, and I'm so excited. You can see from my shades, from the way she's looking. We're ready. Just please come and join us right now. Welcome, welcome, everyone. Another beautiful Saturday, and it's going to be an exciting program. It will be enlightening, and in the end, I hope that we're all going to leave here feeling less tense, a lot better, equipped to help other people going through what we're talking about today, infertility. So, welcome. I see two people joining us already, and I know more people will come in. So, welcome. All right. Without wasting any more time, let me tell you, you can tell there's something different about me today, and it's my frame. And this is on purpose because it is one of the things that I've seen that I've noticed about my special guest today. She does a lot of live shows, and she has such a powerful presence on the internet, on Facebook, on social media generally, and she always has this one signature frame on. So I said, let me come in and look something like her. And it really gets me excited looking this way today. So let me introduce her briefly. Well, I'll let me say the formal one, then I'll tell you the personal introduction. So she is popularly she's known as Oloriranti Ajayi. She is a clinical manager of one of the fastest growing fertility clinic that we know in Nigeria, in Africa right now, Nordica Fertility Center. She's the mother of four children. She calls herself also a grandmother of four adorable princesses, and she's in her late 50s. She looks so young and healthy. She's been married for 3 years. Matter of fact, our wedding anniversary is coming up in next week, and she has a lot of activities lined up to help women again, because that's what she does. She helps women, she empowers women, she does all that she can to help people. And as you saw on the flyer, she's a sex and fertility counselor. She is known to be very resourceful, a very resourceful connector. And another interesting and powerful thing you should know about her is our foundation, the Womanhood for Olori Ajayi Foundation. It started in 2018, but it has gone beyond just a social media talk or platform thing. It has evolved to become a community service, to do bigger stuff like community service projects, charitable initiatives, and equipping women even for small businesses. So she's very active, she's busy, and when it comes to fertility, it is something that is truly calling. So call people, let's learn from her today. On a personal level, she's my friend's mom, and she is just very resourceful. I've learned a lot on our platform, from sex issues to uh, medical health stuff. She is very resourceful. So beyond all the formal introduction, on a personal level, she is like a mom to me, and she's been helping a lot of women. So I will take myself out and my frame off, and let us listen to her help us get this thing going on. If you have any question, please type it in. When she's done, we're going to ask her and we'll discuss more about the tips. You're very welcome, ma.
Thank you so much. Thank you, Dayo, for giving me this platform to talk about what I do, because this is what I do every day and I take pleasure in doing it. I love doing it. I wake up, I talk fertility, I talk sex, I talk intimacy, relationship. So it's it's a good thing, and I also appreciate your platform for focusing on mental health, because that's something that people don't really talk about, and it's really great that you are using your platform to bring this up, even as it affects fertility, because mental health in all aspects of our lives is something that we should focus on. So we are looking at infertility and mental wellness. So thank you for the opportunity, and I hope that our viewers will learn one or two things this
Yeah,
evening. Thank you.
I will. All right, ma'am. I will just be backstage and we're here learning from you.
Okay. Thank you so much, and good evening, everybody. As she has introduced me, my name is Roti Ajayi. The Olori aspect is just is my social media name. I'm not an Olori, but my husband is a king in our own house, in our own kingdom here. So, thank you for giving me this opportunity this evening. I am a fertility, sex, and relationship counselor. I work with Nordica Fertility Center. We have branches in Lagos, Asaba, and Abuja, and Nigeria. So let's go on. Infertility, we are talking about wellness and infertility, but let me just say what infertility is briefly. It is the inability of a couple to achieve pregnancy after 1 year of regular and unprotected sex. And when I say regular, I mean regular. Regular is 2 to 3 days in a week. Regular is not once a month. Regular is not once a week. It is minimum of 2 days and like 3 days in a week. So that's what infertility is. And also, apart from being regular, it's also with no protection. No protection. So the issue of infertility is talked about. When infertility is mentioned, people automatically start thinking of the woman. We look at infertility from the point of the woman. She's unable to have a child. She's barren. She's infertile. Everybody looks at the woman. Nobody focuses on the man. But I want you to know that infertility can be as a result of male factor, which it's about 30%. Female factor also is about 30%. So when I mean male factor, it means the challenge is from the man alone. And when I say female factor, it is from the woman alone, and it's about 30%. Then we also have a combined factor, which is the 30% from the man, 30% from the woman. Then the combined factor also is 30%. Then the remaining 10% is, we call it unexplained infertility. Unexplained infertility is such that we have done tests for the man, we've done tests for the woman, the regular tests that we do for, to check for fertility, and we have not been able to put a finger on something that is causing it. So we say it is unexplained, and that's about 10%. And different people, they deal with infertility in different ways. Infertility is the same all over the world. It's inability to have kids. So what your position on having kids, if it really matters to you, the way we react to it is almost the same. It's just that sometimes the men react badly, sometimes the women react badly. It depends on what the cause is. So different people deal with infertility in different ways. Some are open to talking about it with their spouses, some to talk to friends, some to family members, and some, they just don't want to talk about it at all. They just want to remain the way they are. Nobody should ask them questions. They just want to be themselves. And that's where the problem is, because if you're not talking about your challenge, it's not likely you get a solution that you require. So why some people, they just bottle up their emotions and tend to take, it takes a toll on them. The impact of infertility on the lives of those going through it and their loved ones comes in various ways, and is not limited to any sex. It's not limited to whether it's a man or the woman, depending on the cause. Because even sometimes the toll is on the woman because the man is not cooperating. And everybody is looking at the woman. She's not pregnant, she's infertile, she's barren, she has a lot of challenges from the home, from the in-laws, from friends. When people say anything, it gets to her as if, okay, they're talking about me. It's friends cannot even discuss with her because they don't know the way she's going to react. So sometimes it's a lot on them. And sometimes the woman is looking for someone to confide in, but she's unable to get because people are skeptical. They don't know how to approach it. So it's quiet. She's dealing with it the way she knows how, and it's killing her. So when we talk about infertility and mental wellness, I want to look at it in some areas. Let's focus on like the psychological impact of infertility. When a couple, when they are unable to achieve pregnancy, it affects every aspect of their psychological being. Depression sets in, and it comes in various degrees. There is depression and high level of anxiety. Anxiety comes when the woman has to look at the calendar before they have sex. She will have anxiety when it's time to see the doctor. The doctor is giving them things to do. Mark your calendar. This is the right time for you to have sex. If you have sex at this time, it's not working. If you have sex at this time, then it's likely that you will ovulate at this time, and it's likely that you can get pregnant. So there is a lot of anxiety in that. And when we talk about infertility, also there is low self-esteem, lack of confidence, because even for the woman to be able to go out with her friends, they got married about the same time. You see lots of ladies, getting married about the same time, and everybody is looking for, okay, she has one child now, the other one does not have. It's so terrible that it's difficult for them to associate with friends when it comes to that. And low self-esteem comes in because she feels that she's the one that has a problem. She's the one that's unable to carry the man's child. And sometimes they say it to their faces that, oh, your wife is barren, she cannot give you a child. Even when they don't know what the cause is, because it might even be that the cause is a male factor. But because she loves the man, she wants to protect the man, she's not saying. Nobody is talking about the man. They are always focusing on the woman. So a lot of time, there is low self-esteem. She cannot stand up when the in-laws are around. The mother-in-law will come, she will say all sorts of things. She's unable to reply. And anytime she's coming around, she's always like, okay, let me take the backstage. She's coming. I don't know what she's going to bring this time around. And there is no sense of happiness towards other people's successes. When someone is pregnant, it's not as if she doesn't want to be happy for that person, but there is something in her that says, oh, she's pregnant again. And look at me. I'm not pregnant. I can't even achieve a pregnancy. She got married about the same time. This is her third pregnancy. So that sense of happiness is not there towards that person. It's not as if she meant it, but that's the way it is to the other person. So their success reminds you of your own failure. When your friend is pregnant, when your friend has a baby, when they call you for a baby shower, it reminds you of your own failure. It's difficult for them to think about any other thing. Their focus is just on how to get pregnant. Everything, the way she thinks, the way when she wakes up in the morning, she's looking at her breasts, whether they are full. She's looking at her pad. Is she menstruating again? Has she seen her period? She's thinking of nothing else apart from that. Even when they want to have sex, I'm still going to come to that because that's a major one for me. Even when they want to have sex, it's like, okay, we've been having sex all this while. Nothing is coming out of it. So why do we continue to have sex? So, and also the psychological impact, it's increased use of drugs or alcohol. People tend to take drugs, they tend to take alcohol because they are just depressed. They just want something that will lift them up. So they are prone to taking alcohol, they are prone to taking drugs. And sometimes it gets to attempting suicide or even to think about it. I just want to end it. I am tired, depending on the support that they have, from people around them. Because sometimes the couple, they are unable to talk, they are unable to come together, to reason together what the challenge is. And most of the time, they are not talking to one another, or they just barely talk. Good morning, I'm going to work, and that's it. Nothing personal, no intimacy between them. And so sometimes it gets to that stage that the woman will feel, I think I've had enough, I may want to end it. And of course, there is increased negative outlook on life generally. There is feeling of guilt. I'm unable to give him a child. Then she begins to think about the things she's done in the past. Maybe because I had an abortion when I was in the university. Maybe because I did that. Maybe because I did that. The feeling of guilt. Maybe that's why she's unable to get pregnant. So it comes to her and it eventually gets into her head and depression sets in. And of course, there is persistent feeling of bitterness and anger. When you see someone in your office who is unable to have a child, they get easily angry, easily angry. When people say something, they just flare up as if, oh, there's somebody will be looking at that and like, what's happening to this person? I've just said this and she has reacted in such a way. But some people will understand that, okay, maybe she's going through some things and they understand with her. But most of the time, a lot of people look at them as, oh, she has come again. Let's just put her to one side, because no matter what you say, she will always, take it the wrong way. So it's a bit hard on a couple when they're unable to have children. But I want to say that it's a bit harder on the woman than the man most of the time, because the focus is always on the woman. When a woman gets pregnant, they are looking at her. Maybe in 3 months, 4 months, everybody is checking whether she's spitting, whether she's sleeping unnecessarily or excessively, or whether her tummy is bulging. Everybody is looking. Everybody, oh, hi, in 9 months we'll come to, to rejoice with you. 9 months has passed, 1 year, 2 years, and nothing. Everybody is like, you people are not doing anything. What are you doing? Give us a child now. Give us a grandchild, a grandson. People will just be talking. And they don't know what they are going through. Sometimes they have done a lot of things that is not known to people. They have taken actions, and their actions have not resulted into any success. But people will ask them or say that maybe they are not trying enough. Maybe you are not having sex enough. Maybe you are not doing something enough. So it's usually very, very hard on them, especially the woman, like I said. The husband may not be understanding. The in-laws may not be understanding. Friends are not, they're not really there for them, because sometimes they are afraid of asking. In the office too, it's a lot harder, because you need time to probably go to see your doctor. Sometimes when you are doing fertility check and fertility treatments, it requires you to, go to the clinic on a regular basis, and they may not understand why you have to be leaving your office regularly. So it's a major problem. So then that's about psychological impact. Then it's when we talk about relationships too, there is marital problem, there is marital instability. The man feels that if my wife is unable to get pregnant, I'll probably have to marry another wife, or I have to have a girlfriend who will give me a child outside my matrimonial home. Or sometimes the man is not even planning to do that, but he has a girlfriend outside, because already infertility has affected the couple in such a way that they are not having any sex, or they are not enjoying sex together again. And like I said, that I was coming to that aspect of sex. When infertility happens, the first thing it affects is sex life. It takes away the pleasure of coming together as husband and wife, the intimacy that comes with sex. It takes it away. And before you know it, they are only having sex when it's time for the woman to ovulate. And that can be frustrating. Imagine the woman is ovulating and the man is not at home. The man probably is in a meeting, and the woman has been calling. She's at home waiting for the husband to come, and the husband is unable to pick calls. And by the time he look at the phone and sees he has seen 20 missed calls from the woman because she's ovulating. She's calling the man to come home. He's under a lot of pressure. He's in a board meeting. By the time he's able to free himself to say, okay, my wife is waiting, she's ovulating, let me rush home. He left the office, he was in traffic, he came home, he was, he was tired as he was just coming, because the woman was like waiting and just very anxious. The man just took off his tie and, okay, let's do it. And he got on the bed and boom, there is no erection. That's a major problem. That's a major problem. Then the woman will start to think, as if he's seeing another woman. Is there, why will he not have an erection at this important time? Why would the man not have an erection? So it's usually very, very tough and very challenging. It affects their relationship. It affects their sex life. It affects relationship. It affects the sex life. And social irresponsibility for the man, he goes out drinking. If I go home now, my wife will nag. You say, well, you didn't have an erection yesterday. This morning again, you did not have an erection. Then the man, after leaving the office, he will prefer to go with friends and to have some drinks before coming home. Before you know it, they have given him one lady with one big breast and big bombs, you know, for him to enjoy himself for the night. And boom, 1 month after, the lady comes back to say, Oga, I'm pregnant for you. Even though he may not be the owner of the pregnancy sometimes, may not be the owner of the pregnancy because there is a male factor. But for the fact that someone says, I'm pregnant for you, it feels that, okay, I'm there. I can impregnate a woman. It's my wife that has the problem. Some years back, men usually will not follow their wives to the hospital. A lot of men will not follow their wives to the hospital. But nowadays, things are changing. Maybe because there's a lot of awareness, like what we're doing now, a lot of awareness, and the man has seen that, okay, 30% of the time is man, 30% of the time is a woman. So is open to coming to the hospital to see what the challenge is. And when they run tests, you discover that even though they have been blaming the woman, is the man, maybe he has a very low sperm count or even none at all, because sometimes men do not even have sperm, nothing at all. And if he has not done a test, there is no way he will know that there are no sperm cells. People believe that once you're able to have sex, you're able to go 2 or 3 rounds, then you are fertile. That's not what fertility is. That's not what fertility is. You have to check your sperm, to do a test on your sperm before we know whether you have sperm cells or not. So there is sexual dysfunction, lack of interest, and enjoyment, either party, losing, flair for lovemaking, because it is believed that the ones done have not yielded any results. So most times they just ignore one another, and before you know it, intimacy will leave their marriage. The man will go out, and sometimes even the woman will go out, and it becomes a problem. At the end of the day, the marriage may be dissolved. And it's because they have not been able to come together to talk as a couple. They have not been able to say, okay, this is a challenge. How do we go about it? We need to see the doctor. It's not about throwing blames at each other. No, the idea is see a doctor and know what the challenge is. There are things that can be done nowadays that can get people pregnant. We have different choices to make, if only you are making the right choice, because sometimes people also don't make the right choices when placed in front of them. So their social life also is affected. The stigma that is there, the strained interpersonal relationship with partner, with family members, with friends and colleagues. There is social isolation, no celebration of visit when the friend puts to bed, no gifting, they are easily irritable, and lots of interest in their usual activities. You see the woman, she likes to paint her face, she likes to put on nice things, but because she's unable, she just feels that I've been doing all this thing, nothing is happening, she's just not happy, and it affects every aspect of her life. It affects her dressing, it affects her social life. Her friends will see less of her. Even, most of the time, her friends will see less of her. The men, usually, they still find time to, to socialize, even though sometimes in a negative level. So it is a problem, and sometimes there is change in appetite. The woman tends to eat more or eat less. So it's either she's gaining weight or she's losing weight, because it's affecting her ability to eat well or to think right. Because eating is about what you think. You think you are sad, and the next thing is, if I take a bar of chocolate, I'll feel okay. You take one bar, you take the second one, before you know it, you have taken more than enough, and you keep piling the calories and you gain weight. Or sometimes to the extreme, she's not eating and she's losing weight. And like I also said, it affects work and your professional life, because she's always thinking about it, because her mind is towards having a child. Performance in the office begin to go down, and people will begin to see that she's losing interest. If care is not taken, she will lose her job. And of course, changing sleep pattern also. She's no more sleeping well. It affects the way they sleep. Because it's only when the mind is at rest that you'll be able to sleep well. She wakes up in the middle of the night thinking, sometimes crying, she'll just burst out crying. When she's not expecting a period, when her period is late for 2 or 3 days, she's happy. She's thinking, oh, maybe this is it. Then on the 5th day, the period comes. Most of the time, what happens is that they begin to cry. and that takes a lot because they cry this month, they cry the following month. If care is not taken, depression sets in. Depression comes in little ways. Before you know it, it becomes a big issue. And of course, the financial impact. When people are unable to have children, the finances, it takes a lot because you have to see the doctor. Sometimes people go to some doctors to treat them, to test and all that. They are not seeing the right doctor. So they've spent so much in other places, and eventually they have to be referred to specialists. Then they come to see specialists and you are asking, for them to pay in millions, and they feel overwhelmed because it's affecting their pulse. They have to pay for tests, they have to pay for procedures, they have to pay for a lot of things. And sometimes it doesn't just come, the finances will not just end with a cycle. Maybe if they are doing IVF, for instance, it may not just end up with one. They may end up doing 2, 3 or more cycles before they are able to achieve a pregnancy. So it takes a lot for them to, I don't know whether I'm too fast. I'm just talking. I'm just talking. I hope people are. I hope people are listening. Okay, so okay,
Oh,
so
people are listening. I said you're not talking too fast. We're following you and just taking everything in.
okay,
Yes, ma'am.
okay. So it takes a lot on them, and their finances. Sometimes they're unable to meet up because maybe the salary they're taking is not so much, and they have to leave so many things. I remember one of my clients. He did the couple did IVF, I think 11 times before they are able to have a child. And they tell you how they were able to cope. It was really, really a lot. Really, really. Because sometimes you see them saying, oh, for 3 months, we cannot afford to pay for DSTV. For 3 months, we cannot afford to do this. All Ashwebi must be closed and all that. So they have to deny themselves for so many things before they are able to afford a cycle of IVF. So it's really, 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 really a lot on their finances. Fertility treatment comes at a cost, and it's a bit heavy. It's a bit heavy, but that's the way things are because it's technology based. It's technology based, so it's a bit expensive. But we also say that when there is a will, there is a way. When there is a will, there is a way. Yes, that's the right word. So when you need something, there will be a way, because a lot of people eventually they spend money outside, they go to wrong places before they get to the right place, and the wrong places are taking so much from them, so by the time they come to the right place they are drained financially. So it's a good thing that people are listening. And sometimes when we talk about infertility, there's another way. Some people, probably because they've had a child and they are unable to have more, they want to have more. That's also a problem, because it's not just for people who don't have at all. Even for people who have had one and they want more, it's also infertility, that is secondary infertility. And they keep asking themselves, why am I not able to have again? I've had children before, I've had one before, or I've gotten pregnant before. Why is it that I'm only able to get pregnant now? So it takes a lot on them, on every aspect on their lives. For the man, especially when the man has been diagnosed of not having sperms, it takes the manhood away. What makes a man, it takes it away. A lot of people cannot just agree to the fact that someone is offering me donor sperm, that I should use donor sperm because for me to be able to have a child. Some people cannot just imagine that happening to them, but it is real. It is real. Some people do not have sperm cells. And when they don't have sperm cells, the only alternative, if they want to have kids, is either to use the donor sperm and your wife's egg, and your wife carry the pregnancy, or you go and adopt. That's also an option for people who don't have maybe sperm or eggs, because some women also, they cannot achieve pregnancy using their own eggs. They have to use donor eggs. So sometimes the implication of the choice of treatment also affects them. I remember a lady whose husband was supposed to use donor sperm some 5 years ago, She refused, that she cannot imagine herself carrying a pregnancy, knowing fully well that the sperm belongs to another man, that she cannot do it, that they would rather remain the way they are. 5 years ago, she was around 33, 34. By the time she came back, now that she's ready to use the donor sperm, we are now talking about using donor egg also for her. So it's difficult, and that's what they eventually settled for: donor sperm, donor egg. But the beauty is she'll carry the pregnancy, and she'll feel committed like a woman. I'm carrying pregnancy, I'm pregnant, I'm going to breastfeed a child. And that's what is different from, adopting a child. So people need to also take decision early. If you have to take a decision, please do take it early, because remember that age is important. So the effect on the man having to use donor sperm is a lot, because he feels that sometimes they feel that they have to. Sometimes they think about suicide. Why will I not have sperm? What did I do wrong? I didn't do anything. Sometimes it's not about what you have done, but sometimes it is maybe you've had some infection in the past that has affected your reproductive organ, and you are unable to have sperm cells any longer. Or maybe because that's the way you were born, because some people are born that way. They don't just have sperm cells. And the only option is to use donor sperms, and it feels so terrible. A man that you ask to use donor sperm, sometimes he just leave the clinic and will not go home in 3 days, just unreachable, because he thinks that life has finished for him. But that's not true. It's the way you perceive it. If there is a problem and there is a solution, please go for the solution and make yourself happy, because by the time a child gets into that house, the scenario will change, the feeling in the house will change. But of course, it comes with a lot of counseling. People will need to be counseled to know that you are bringing a child to the world. You have to love that child. You have to love that child. So it's important that people understand what they are going in for, and accept the way they are. Yes, you are unable to get pregnant spontaneously because of certain things, but you have options of using maybe IVF, or doing IUI or something, or using certain drugs to get you pregnant. So it is important that people will just find a way to deal with the solution, to deal with the pressure from close relatives during infertility as a couple. Men should not allow their wives to be battered by family members. Mother-in-laws, please leave your son's wives. Let them deal with their problems. It's very important. Let them deal with their problems, because sometimes I wonder, when a mother-in-law is after the wife, what if that child is yours? What if the problem is the man? How will you relate? Or if you are saying the wife should go, what if that woman is your own child and she's now the one with the problem? What will you do? So mother-in-laws, please let them be. Let them take their decisions. They vow to love each other. Let them find a way out, and let them love themselves and find a way around their problems, and never feel alone. The husband, the wife, you must not feel alone. You must come together and discuss your problems and agree on what to do. So Dio.
Man, I was going to thank you, ma'am. Yeah, I mean, the package has just been total. You touch different important parts that makes everything come together. But there's actually a debate sort of going on from the comments about, you made a statement about when other people's success reminds you of your failure, of your weakness. That is profound. That is reality. But somebody said it's envy, and another person is responding that it's only envy when resentment comes with it. I know that it's one of the things people go through, and I would like you to speak to that, because this comes with the psychological impact of one not being able to have what you desire when it comes to childbearing. So I want you to speak to this for the sake of those that are talking about it, and then I will ask the other question.
Well, we're talking about infertility and mental wellness.
Yes.
It is a normal thing to feel that way. It is normal for someone to feel that way.
Mm-hmm.
But you see, some people feel that way, but they don't do anything. They just let it slide. Okay, they've invited you for a naming ceremony. They've invited you to a baby shower.
Baby showers. Mm-hmm.
Going because it reminds you of your failure. It's normal. People should be left alone to take their decisions. But you see, sometimes, like I said, people are depressed. So even when she's taking actions, even when she's envious from that word, don't forget that it has affected her emotions. And that's the way she's able to process it. That's the way she's able to react. That does not make her a bad person, but she's reacting because of the situation. And sometimes because of inability to have a child, and it's been going on and on for years, she goes into to hide. She's not willing to associate with people any longer. And if care is not taken, she becomes really depressed and gets sick, and she'll become Dio's patient.
Yeah.
When they are still in my own care, we can still talk about the solution. But the moment she leaves my care, because now I cannot handle her psychological problems any longer, then she becomes Dio's problem. So that's something that we should realize. It goes from being unhappy to being envious to being even sometimes feeling that I can kill this child. She can get to that stage to say, I want to kill the child of the other person because she's no more in control. Because she's no more in control. So it's not really her fault, but the emotion that the failure brought.
Yes, ma'am. And I agree with you. And at this point, I want to talk about this mental health tips for couples going through this. And for those of us that are around them, or even when it's happening to us personally, one of the important mental health tips we should know is that we have to acknowledge our feelings. When we're going through a difficult situation, when we're going through something as painful or as life impacting as infertility or anything that has to do with that, we have to first identify, acknowledge how we feel. The second thing is, when we feel the way we feel, we should give ourselves permission, and I will limit this to those that are going through fertility issue. Give yourself permission to feel the way you feel. You are sad, you're unhappy, you feel down, you feel like crying. You don't feel like attending this baby shower. Don't acknowledge your feeling and give yourself permission to feel that way. And it is then that it gives you the insight enough to, you are in touch with yourself, and then you seek, what can I do now? But when we do things based on cultural expectation, societal expectation of, I need to just rejoice with other people, that's when your own joy will come. Don't talk like that, don't think that way, God has a reason for doing this, and people try to make you suppress your feeling, then it leads to all these points that she's talking to us about. It leads to isolation, social isolation. It leads to you, hopelessness. It leads to you just trying to be on stage, acting for people to see, while you neglect your actual feeling. So to those who are talking about envy, or, it is not really envy. When people feel that way, it is genuine feeling. And like somebody said, it's when you now resent that we can say maybe there's something else going on. And even at the point that that is happening, then you should know, hey, I'm getting resentful. Maybe I need help to let out my feelings and let somebody help me. So I want to chip that in at this point. But Mar, you mentioned some things that I want you to talk a little bit more about. You mentioned that sometimes people had spent more money, energy, resources in the wrong place before they finally find the right place. Can you tell us some of the things that people should do, or what people should look for when it comes to them making choices or treatment choices or seeking help about infertility? Because this is also very important.
Thank you. You know, some people from get-go, they know that they have some challenges. For instance, if your period is irregular right from the time before you got married, there may be a challenge, for you in getting pregnant. So that's a potential problem if your period is irregular. So when you get married, don't wait. Seek help and go to fertility specialists. Gone are those days where we take all our problems to general practitioners. Everything, it's all our family doctor that takes care of us. That's in those days. People don't do that any longer. But if you have headache, if you have body pains and all that, you go to your general practitioner. It's okay. If you have a bone issue, you go to see an orthopedic surgeon. This century that we are. So if you have a problem getting pregnant, go to fertility specialists. By the time you say you want to see your family doctor, they treat you for 3-4 years. They keep telling you to take Clomid. Sometimes there was a time I met a guy and he said the doctor has been asking them to take Clomid for the wife to get pregnant. I said, did you check your sperm? Did your wife do HSG to know whether the tube opened? He said no. I said, then I thought you are educated. The least you can do is go online and find out. I'm taking Clomid. What do I need to do? You need to check if the man, for instance, there's no sperm cells, and your wife is taking Clomid. Let her take now till kingdom come. She's just taking multivitamin, as far as I'm concerned, because there are no sperm cells. So she can't get pregnant. So see the right doctor at the right time. Once you have waited for 1 year and you're unable to have a child, you're unable to get pregnant, please see a fertility specialist. Some people go to family doctors to get them treated. Some people stay in church. They keep praying and they will pray their tubes to grow. Tubes are blocked and you are praying. Please, your tubes cannot grow. Your tubes are blocked, you need IVF. That's the truth, that's the reality. So when you go to church and you spend all your years in church drinking water, praying, I'm not saying you should not pray. Yeah, people can pray. We pray. I pray. I'm a Christian. But when you have appendicitis and the doctor says you need to get your appendix removed, you don't go to church. When you have ulcer, you don't go to church. You go to the hospital. It's the same thing with infertility. When your tubes are blocked, please go to the hospital. Not some tea, not some, you have fibroids, you need to remove your fibroids, somebody is asking you to take tea. Tea cannot help you. That's the truth. So people need to read, they need to understand what is going on. And it's unfortunate that a lot of educated ones are in this category too. They're in this category. I see a lot on Facebook, on social media, they're advertising this and advertising that, and I just shake my head. Something to unblock your tube. Why do you think medicine is advancing? Why do you think technology is advancing? The first IVF baby came in 1978 because the mother's tubes were blocked. And they did IVF and she had a baby girl. She's 30-something now. She's 1978. How am I saying that? She has her own children. She has her own children now. So if they didn't take that opportunity at that time, it's not likely that they have children. And a lot of people are in that category. So please, don't waste your time, don't waste your money, don't waste your resources. By the time people come to fertility centers, most of the time they are older. And do not forget, as you grow older, as a woman, your chances is becoming less. When you are 25, your eggs are 25 years old. When you are 38, they are 38. When you are 40, they are 40. So it's not as if when you are 40, it's just like that, you get pregnant. No, your chances is reduced. So you need to take actions quickly. So when you are not getting pregnant, please just run tests, the basic test. Check the husband's sperm, check your wife's hormones, check the tubes and all that. Let us see what you have. then one can now advise on what you need to do. But if you sit at home and pray and start doing all sorts of things, then you probably find yourself in a situation where you will have to take some decisions that will be very hard on you later on.
Yeah, yeah. Thank you for saying that. And in this group, we put the spotlight on leaders a lot, religious leaders, political leaders, organizational leaders, and everyone. And this two things I would like to mention here, because you talked about the impact of infertility on one's work productivity at work, being absent because of the things they have to do. So mental health in the workplace is also something that is important, so that if people don't necessarily have to share all that is going on, but if the workplace environment promotes mental health, at least they're able to find it easy to seek help or support to help them with what they're going through. And then you talked about going to church, like not going to church, we pray and all that. But I think this comes down again to leaders in religious capacities, that they should encourage people, like, well, we'll support you with prayer, and then what cannot do. How about we investigate and really know the cause of the problem, so that we're able to make progress. So please, as many leaders we have in this group, we have a lot of leaders in this group, and it makes me feel really blessed, because when a leader gets it, it impacts the lives of so many people under them, policy making and all the decisions that will make life easier for people. So leaders in the group, please, let's direct people to seek help in the right place and give them all the support that they need. So this last question, you talked about, I never thought about it that way. You talked about, for example, if the man does not have sperm cells, and they have to use a donor. And you talked about the timing of making decisions and the things that can come. I know that Nordica has, we've talked about this, and you have like a counseling unit where you help people to do, to be able to make a decision, at least support them through their decision making and the treatment process. I want you to speak to us about the importance of this, even while people are trying to make decisions. And the part where a man is the experience, you've been helping a lot of people, and you work with a lot of couples. In your experience, how are men able to get support in the instance that it boils down to them, the problem coming from them? How do they get support? How are they supposed to seek support in a way that helps them life? And then with counseling, as you have it as part of your treatment plan at Nordica, how would you speak to encouraging more people to integrate that into their treatment plan for fertility?
Thank you. That's a very important topic. You see, when we do their test and we discover that the man does not have sperm cells, it's a lot. When you break the news, it's almost like his world is collapsing. It feels, if one was supposed to like maybe have a camera to capture that moment, you will see his face will just go down like, oh my God, how did I get here? And a lot of things will just be, running in his mind. But that's where counseling comes in. You talk to them and you take them through that process of accepting what the problem is, the challenge is, then take them through the decision that they need to take. Whatever decision they are taking, we stand by it. We talk to both of them as a couple, talk to them individually, because sometimes the man is willing and the wife says no. Sometimes the wife says yes and the man says, over my dead body, I would rather remain this way than to use another man's sperm for you to get pregnant. So sometimes it's difficult, but a lot of people are buying into it now. And again, the problem is not only at the time they are taking decision. When she gets pregnant, that's when reality sets in, that truly I am the one that has the problem that will not make my wife to be able to get pregnant. And She's pregnant now. That's reality. I remember some years back, 3 a.m., someone called me that the man wants to kill himself because the lady was pregnant. She was about 36 weeks at that time. The man just felt tired. He just felt that he was losing it. He wanted to kill himself.
Was that because it was another man's, or it was a
Yeah,
different
reality, the reality. And husband and wife, you will still quarrel, you will still fight. So sometimes the man feels that, okay, she's doing this because she knows that I'm not the father of the child. But you see, the moment you are taking a decision to use donor sperm, you must be ready to say, I am the father. And that is where counseling comes in, for you to accept that reality. Because if you don't accept the reality and you are just going through the process, it will bounce back.
Right.
When the child comes, it's not likely that you're going to love that child. And it becomes a major problem for the man, for the woman. Sometimes you see, I know of a marriage. The marriage didn't survive. They had a set of twin beautiful boys. They were a young couple, like I so much admire, I so much love them. They went through this process. They had a set of twin boys, and eventually the marriage broke down. So it's that's decision. It's a long-term decision. You take a decision now, it's throughout your life, it's throughout your marriage. So every day you have to live by it. And it's on the woman also not to remind, because when you fight, don't remind that man that is not the father. He can kill both of you.
Yeah.
If he gets really, really angry, he can do anything. So when you get pregnant, it's a process, it's a long-term process that you have to continue to manage one another. Oh, and you see, that's where intimacy comes in as a couple, to be able to, talk together, to be able to share thoughts, share your thoughts. Oh, I'm angry, I'm sad, I'm happy. Share those moments with each other. So if the man is able to express his feelings, then the wife will know where to help. But in a case where they are like this, then at a point, when the man is unable to drop money, chop money as we call it, the woman will say, how will you be able to drop money? With our mouth, women, we just say, blah, 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 1, 2, 3, and the man will give you a slap. Before you know it, things will degenerate and it becomes a major problem. So I think the counseling is on the man, on the woman, and as a couple.
Yes.
So it goes beyond just doing the treatment.
Yeah.
When the treatment is successful, when they have a baby, it's an ongoing thing for them to be able to accept. But some people accept the child, they accept it, and the bond that is, when I see some of my clients and I'm like, oh, this is beautiful. They love the child because they are able to come to terms with the fact that this is a problem that he cannot solve on his own. If he's able to solve it, he will solve it. This is the only way out for them to have kids in the house. And you make that decision early because your wife is still able to use her eggs. If you don't make that decision early, then you find yourself taking that decision and using both donor sperm and donor eggs.
Yeah. Another one you haven't mentioned is surrogacy, like those who would eventually need somebody to even help them carry the child. And while I'm going to let you speak a little bit to that, you keep talking of timing, the timing of the treatment. I think this is very important, and everybody should know that let's seek help on time. Let's also be considerate when we're making decisions, because as the couples get older, the chances of them being able to do something, maybe within what they still have, is limited. But what the examples you mentioned, the marriage eventually breaking, or maybe affecting one's psychological being to the point where one goes to the extreme of wanting to, die by suicide, or wanting to kill the wife, or all this crazy stuff. It shows again the importance of incorporating therapeutic psychotherapy or counseling along the way, not just before the treatment, during the treatment, to help you also stand by your decision. So, surrogacy is another one, when somebody would help you carry the child, and then it comes to you. I don't know how people reconcile that, but do you, Nautica, do you follow up with people? What's the trick? Can you tell us the summary of the treatment from when they step into your building or the facility till they decide and ongoing? Just what it's like for us to know.
Okay. When people come in, they make inquiries. They know what's the treatments that they can take. We offer them. We don't force people to do a particular treatment. We just take you through it. Then you can decide. So when you have taken a decision, then of course you run your tests. When you run your tests, you do a review with the doctor, and we start the process. So there are consents to be signed. Everything has consent. You are signing that you're doing IVF. You're signing that you are doing donor egg or donor sperm. You are signing that you're doing surrogacy. Somebody is caring for you. Everything has consent. So they make their commitments and they start the treatment. Um, Let me say something briefly about time. Age is very important for the woman. Like I said, when you are 25, your eggs are 25 years. When you are 40, your eggs are 40. So it's better you make a decision early to do whatever you need to do. Some women are unable to take that decision because they are not married, because there is no suitor. They want to get married, they want to have kids, they have their career, but no man is coming around. You can freeze your eggs. So if you freeze your eggs at 30 and a man comes at 40 and you want to use those eggs that you've frozen at 30, your eggs are 30 years old. Unlike if you wait until you're 40, your eggs are 40. So if you freeze them early, it's better for you. And some people do that. So you can freeze your eggs, you can freeze sperm, to the time that you want to use it. Some people freeze sperm because maybe they want to go for some type of treatment, maybe chemotherapy for cancer or something, and they can use the sperm at a later date. So people do that. Then surrogacy is someone carrying your baby for you. The the you In surrogacy, it may be your own eggs and your husband's sperm, but you are unable to carry yourself. You are unable to carry a pregnancy to term for one reason or the other. Some people cannot carry pregnancy because they get sick. Some people have severe hypertension, severe diabetes that is not well treated, and anytime they get pregnant, they get really, really sick, and it can claim their life. So they opt for surrogacy. Some people, they have, in the course of maybe one surgery or the other, they've taken their uterus away. They don't have a uterus where they can carry pregnancy. So somebody will carry for them. They're using their own egg and the husband's sperm, but somebody is just carrying. So the person does not have any genetic connection. It's just a carrier. It's just a carrier. So the person will go through the process, sign all the consent, see the lawyer and all that, and so the surrogate is going to know that the baby does not belong to her because she does not have any genetic component to it. So she's just carrying. So the moment the pregnancy is over, she hands over the baby to them and she goes her own way. So that's what surrogacy is. It's gaining ground in our country now. It's gaining ground. People are doing surrogacy for one reason or the other. So it's a welcome development in our country also. So people are doing that, and it's helping a lot of people who are unable to, or maybe the uterus is bad, they had some surgeries, and the whole place is it's with a lot of scarring.
Yeah,
Having pregnancy, yeah. So
yeah.
people just do that, and some are doing it for cosmetic reasons.
Mm-hmm.
Yeah, I just don't want to carry pregnancy. I want somebody to carry for me.
Yeah. He wants to skip a lot of hassle, and some people,
Yeah.
there's some people are just willing to do it. So I'm still listening out for the part where you talk about the counseling in the process.
Yes, counseling when they after the review of results, when they see the doctor and doctor is taking them through the process of the results, you review the sperm, review the hormone test. There's a procedure that we do. We look into the uterus. We call it sonohysterogram to see whether the uterus is okay, and all that. So when they've done that, then you see the counselor talk about the results, to talk about the options that the doctor has given to them. The doctor may give one or two options. Let's take, for instance, a 40-year-old. She has two options. Option of using her own egg and option of using donor eggs. She has two options. So the counselor will take you through that process for you to understand the advantage of one and the other. Then you are now making an informed decision.
Right.
So she's making an informed decision. So whatever decision they have made, then they will have a counseling on it. So let's say, for instance, you are taking the decision that you are using your own eggs at 40. You know the implication of using your own eggs at 40, that you may not produce enough eggs. You may not produce enough eggs. There is a risk of cancellation of treatment. So counseling will go through all that so that when it happens, you are not you are not, it's not new to you. You already know that there is a possibility that you are not going to have many eggs. There is a possibility that you can get the cycle cancelled. In the middle of the process, you can cancel the cycle, because if you are not doing well, the doctor will advise that you cancel it. So there is a counseling at that moment also. Then when you have finished your treatment, when you have the eggs are out, we have put the sperm, you have the embryos, and you will put the embryos back. Of course, there is that moment also that you need to talk to someone that, okay, you've done all your treatment, you are waiting for 2 weeks for the pregnancy test to be done, and then we wait for the test. So when it's positive also, it's a process. So before, during, and after. Because when it's also positive, like I said, if you are taking a decision, it's easier for people using their own eggs and their sperm. When the woman is using her own eggs and the husband's sperm, it's easy. It's easy. Even when sometimes when you tell them that you should go through cancer, they say, "Ah, no, madam, we are fine," because now she's pregnant. They are happy. That excitement, that happiness, you see it on them, and they laugh and joke and all that. But when there is a donor gamete, when there is a donor sperm or donor egg in use, then they probably need further counseling to say, this is the moment that we're waiting for. Now you're pregnant. These are the things that you need to do, and to accept, and to begin to think about the way you're going to go through it when the baby finally comes. Because when the baby comes, sometimes you see some people go through that moment. She has used donor egg and look at the baby and say, after everything I did, this baby is still not mine. And people get they get there is postpartum depression. Postpartum depression can come at that time because of the way that her mind has been going through that process. She may not say it to anybody, but during the pregnancy, she's thinking about it. When this child comes, it's not mine. Whether we like it or not, it's not my child. And she carries on to the time that she gives birth. She may go into the So everything is still about talking to them. We are in contact with them. We see them. We ask them to come, unless maybe it's not possible. We ask them to come. We want to see them to come for scan at each stage until they deliver. We are in touch with them until they deliver. We still talk to them even after delivery. We want to know how the baby is going. And we also encourage them to bring the baby to the clinic. Let other people see that the babies are normal babies, because that's another concern. People think IVF babies are not normal. They are normal. They are beautiful babies, intelligent babies. So we want them to bring them to the clinic for other people to see. We encourage people to talk about their treatment, to talk about IVF. I have done IVF. My baby is IVF baby. We have some people like that. They are willing to talk. They are willing to share their story with people. And to me, it's a beautiful thing to do. It's a beautiful thing to do, because any other person out there thinking of spending 3-4 years in church praying, hey, not the way our people pray in church because of having children. The main thing they will not do, but they will go and pray, drink water, drink olive oil, everything. But the main thing of seeking help where they are supposed to, sometimes to them it's not money, it's just religion. It's just religion. It has been said. It has been said, and I believe so. Yes, it's said. It's the word of God. But please take a step of faith and do what is necessary.
Thank you very, 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 very much. And that people are talking. I know that the good thing, viewers, is that our guest is also a member of this group. which excites me when I have, we are using the resources we have in this group. Like I told you, we have a lot of leaders, and see the kind of people that we have in the group. So she will still answer some of the questions. I heard some people saying, what if the baby if the surrogate mom comes back and says, I want my baby? Or what about the consent and things like that? So she will respond to some of these questions that you're asking. But let me wrap up this way, and then I'll let her say her final words to us. So from the mental health perspective, I want to emphasize this. As she told us in their own plan, the treatment plan that they have at Nordica, which I am very impressed about, is that counseling is there for you every step of the way. And the thing about it, which she also mentioned about getting help in the right places, going to fertility centers so that you will get appropriate treatment. Therefore, if you have a counselor in a fertility center, be rest assured that they are trained in that field. So, like I said last week, if you came to me with any fertility issue and stuff like that, I will not be able to help, because we have counselors that specialize in issues of fertility. They know the process, they know the options, they know the psychological impact. From their experience, they have so many resources to pull from for you. So while we have counselors helping with decision-making treatment plan, we also have those who specialize in you building your coping skills, because all these things will come. Even when you have a successful treatment cycle, even when you're carrying your baby, the past, the things you've gone through before you get to your success phase, do not just disappear or go away. It is part of you. So coping with all those things, staying mentally healthy, even for yourself, before you come to your relationship with your spouse, before it comes to your relationship with the child, before it comes with all the things that you will deal with, and thinking back on your life journey, getting an appropriate counselor or psychotherapy to help with this is very, very important. So she has highlighted a lot of things for us to know. I just want to emphasize the mental health part. And this is not just for women, it's for men as well. She mentioned that now we have more men coming out to support their wives, or at least to also find out what is going on. So I encourage family members, colleagues, friends, siblings, in-laws, parents, even when they feel that you're close enough to them to share what is going on with you. Let us step back from being the counselor, because we are not specialists in that. Let us encourage them to add mental health care to what they're going through, and give them the healthy space for them to do what they need to do without too much interference. So please, putting these two topics together is very intentional. We've heard from her as an expert that treatment is important, and I'm also emphasizing it that while you go through the appropriate treatment, do not neglect the mental health aspect of it. So thank you very much, Ma, for your time. I want you to say your last words to all of us to learn before we say bye to our viewers today.
Thank you so much. This has really helped a lot, and I enjoyed every moment of it. And I just want to add that there is something that just came to my mind. Effect of drugs, effect of alcohol and all that on sperm. Sperm parameters are getting so terrible nowadays. You may have the best of sperm when you do the counts and the morphology and all that, but the DNA integrity is bad because of drugs. So people should be careful. Our lifestyle, the way it affects sperms nowadays, is becoming a major problem. Becoming a major problem. So people should be aware of that. So when you take your drugs as recreational drug, remember it's having its own effect on your sperm. And my last word will also be that as a couple, you must be together, you must think together, you must walk through your challenges together. Don't leave one person behind. Don't be the macho one. Do it together. Talk as a couple. Your intimacy at this time is very, very key. Very, very key. If you have not been doing that, please work on yourselves and hold each other. And stop looking at, oh, maybe what if I've done this, or maybe if I've not done this, maybe I wouldn't be where I am. Let the past be in the past. Seek help and do not waste time in seeking help. And like I mentioned, if you know you are not ready to get married, or because of your career, or because the man is not there and you desire to have children, please consider freezing your eggs as early as possible. Those would be my words for you this evening.
Okay, a last question. So, at your facility, do you provide that? Do you provide that service of freezing egg? Because somebody said, "Oh, she's just hearing about it," and I just want to know if you do it so that people know.
Yes, we do.
Okay.
All forms of treatment. We freeze eggs, we freeze sperms, we do surrogacy, we do PGG for sex selection, for genotype selection. Yeah, everything.
Awesome. Awesome. I told you people, we have great people here. We have resources in the group. Ask questions, send questions to her. And I also want to say she has this wonderful page, the Woman Who Wakes Up with Olori Ajayi. She talks about everything. You never know what she's going to post in the morning. And you go like, oh, I never thought about that. From, how women should go to bed at night, wearing underwears or not, how not the kind of lubricants to use. She has a very resourceful page. Look for her, follow her, learn freely. Just as we have these free resources in the group too. I'm really delighted that you came here, Ma. Thank you so much. Let me put my frame on again while I say well, I say thank you and bye to everyone who joined us today. Thank you so much for your time.
Thank you so much. Thank you.
And we'll respond to all the other questions as soon as we can. Bye. Thank you for joining.